Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access at stepsforward.org.
Hello, and welcome to this episode of the AMA Steps Forward podcast series. I'm Dr. Margaret Lozavatsky, Vice President of Digital Health Innovations here at the AMA, and your host for today's episode, where we'll be discussing AI governance. This is our final podcast in a series of 3 on this topic, as we highlight organizations that are finding ways to successfully navigate the evolving landscape of AI. As healthcare organizations increasingly adopt AI in various ways, establishing clear governance and oversight structures has been more important than ever. To support this effort, the AMA has developed a Steps Forward toolkit on AI governance, providing practical guidance on building a strong governance framework. The toolkit outlines key steps for success, including establishing leadership structures, aligning AI initiatives with strategic goals, developing policy, ensuring proper training and education, and continuously evaluating the impact of AI on clinical care. As part of this toolkit, we're highlighting a few healthcare organizations that have had success in AI adoption and implementation. So far, we've discussed what success looks like at the University of Pittsburgh Medical Center and Johns Hopkins Medicine. Now joining us today for a final success story is Dr. Vincent Liu, who is the Chief Data Officer at the Permanente Medical Group. Thank you for being here today, Dr. Liu. Before we get started, would you mind telling our listeners a little bit about yourself and your background?
Thank you very much for the invitation, and it's really a pleasure to join you on this podcast. Like many of us, I wear several hats in our organization. I'm a practicing pulmonary critical care physician at our Kaiser Permanente Santa Clara Medical Center. I run a research program that is funded by the NIH using AI and machine learning to examine EHR data to improve care for life-threatening conditions like sepsis. I direct part of our informatics track within our Delivery Science Fellowship, where we get to train young, talented scientists to use AI and advanced analytics to deliver on our promise of high quality and affordable care. And then finally, as you said, I'm the Chief Data Officer for our medical group, so oversee responsible implementation and evaluation of AI and ML for our more than 4.5 million patients and 9,000 physicians in Northern California. I think I like to think of myself in this role as a data steward, so that no single drop of patient data will go wasted as we use analytic techniques, AI, in order to maximize the value of that data to improve care for our patients and improve the way that we practice.
That's fantastic. It does sound like you wear a lot of hats. So jumping right into our conversation on AI governance, can you tell us a little bit about the Permanente Medical Group's journey with AI governance?
Yeah, I mean, if we step back from a lot of the advances that are happening today, we've been working with various AI technologies like predictive models for a long time. For example, back before we had even deployed our inpatient EHR with Epic, we developed something called Advanced Alert Monitor, which was a early warning score, deterioration score that would scan patients' records, look at somewhere between 50 and 100 variables related to vital signs and labs and other patient clinical data. Back then, AI was not what it is today. Developing a model in terms of getting all that data into one place and developing the algorithm was really the bottleneck. But through working that process, we've learned a lot about how to carefully oversee the development, validation, instantiation, and deployment of these tools. As part of that process as well, deploying this tool across our thousands of clinicians who engage in inpatient care and across our 21 hospitals, we've also been learning about the challenges of real-world implementation and focusing on kind of seamless clinical integration and ultimately real-world outcomes. So, I mean, we assessed our model, the AAM model, rigorously, and our results were published in the New England Journal of Medicine, showing that deployment saved upwards of 500 lives per year. So that focus on not only the careful practice around model development and validation, but also that seamless integration with our clinicians and then the rigorous evaluation have guided us as we've thought about governance of AI moving into this new frontier where we're seeing lots of new types of technology emerge.
I love that. You highlighted a couple of things. You highlighted the various ways you're thinking about these technologies and making sure that you're evaluating impact and clinical outcomes. Fantastic. And I also really appreciated the mention of the fact that AI has been in clinical medicine for a long time. So, as an organization, how would you say you prioritize augmented intelligence in your institution?
Yeah, I love that you put it that way because we've been talking about augmented rather than artificial intelligence for a while. The way that I think about it is that augmented intelligence places people, patients, clinicians, and communities rather than algorithms at its center. So instead of thinking about AI as just a hammer looking for a nail, it's really thinking about how this technology, whether it's a more simplistic form, whether it's classical or traditional AI, all the way out to generative AI, can help our doctors do their work more efficiently, more effectively, and more safely. So a lot of this has to do with choosing the simplest or most integrated tool to solve the specific task at hand, rather than focusing on only what's the frontier technology. Now, of course, as the new AI tools are getting more and more powerful, we absolutely want to take advantage of the innovations and enhancements that they offer. But really thinking about contextualizing AI into this entire large system and adhering it with our principles is how we're thinking about integration.
Yeah, all great points and really highlights one of the most important informatics principles of what is the problem we're trying to solve and how do we integrate the solution into clinical medicine. I really appreciate that. We talk a lot about when we think about AI governance, the role of our leadership. Can you talk a little bit about the role of your CEO, your executive team, and how they are championing these tools?
Absolutely. So our CEO, the CEO of the Permanente Medical Group, is Dr. Maria Ansari, and she's been an absolute champion of AI, and that means responsible AI. But I don't love that dichotomy because it's kind of like saying she's supportive of technology, but only responsible technology. I think it's implicit in the way that our group practices and the way that we kind of, again, align with our principle and the vision and mission with which we practice. So, of course, for many years, decades even, we've had strong operating and oversight models for all of our technology. So I like to think of our responsible AI program as an extension of the way that we've always thought about technology, both the benefits, the risks, the unintended consequences, as well as, what our patients and providers think about it. I think the use of technology is really in Kaiser Permanente's DNA. Our founding physician, Dr. Sidney Garfield, 55 years ago, wrote in Scientific American that he believed that a computer should be at the center of healthcare to ensure that's effective, efficient, and safe. So again, I like to think of AI, including responsible AI, as being in our DNA and something that our leadership has supported since day one.
I love the comment about the fact that responsible technology is in your DNA, that this concept of responsibly implementing these tools is not new with AI coming about, but has always been a part of the way we think of implementing technologies. This really delves into the next question very nicely, which is the topic of liability and risk. We talk a lot about liability and risk when we think about AI. How is the Permanente Medical Group addressing challenges such as data privacy, algorithm bias, and the liability that is inherent in the use of these tools?
Yeah, that's a great question. And so I think that's really a frontier issue and a challenge for every health system. So I don't want to go out there and say that we've solved the problem or cracked the nut, because I think what we're seeing, for example, in cybersecurity is that malicious actors are constantly trying to advance their own skills to penetrate secure data. And so, we follow the same policies and procedures we do for all of our patient data in order to maximally provide the security that we can to ensure that those data are contained within the system, are protected, remain private. And, I think that's a big concern when you talk to patients and what is their level of trust about AI. Often it's not about the algorithm itself. It's about, what's happening with my data, where is it going, who is using it. And so we know that to build that trust, data security and privacy is going to be essential. In terms of algorithm bias, again, I think we know that algorithms can produce potentially differential outcomes across different subgroups, and that can have a downstream unintended consequence of leading to different practice. So we take our algorithms through metrics of fairness, for example, for predictive models, and look at these different metrics to understand kind of what is the potential to reweight the algorithm to minimize any differences in the groups, or should we change the practice in terms of at the implementation layer, at the human layer, in order to work on mitigating those risks? That's not a solved area of science, I would say, something that people are working hard on, especially when it comes to generative AI, because it's much more challenging to feel like you have your arms wrapped around an unbiased model in generative AI. And then finally, when it comes to liability, at this point, we're educating our physicians that they're the final decision makers. And these predictive models or these tools are not omniscient. They will make errors. For example, things like false positives or false negatives. We know that's a part of a statistical model. And when it comes to Gen AI, the way that they summarize data, synthesize it, or present it can introduce potential for things like hallucinations. So I think what we need to arm our clinicians with is the expertise to assist the validity of that output and then to edit the outputs and take control over the process. Still stay in the driver's seat in terms of their expertise in clinical decision making, and then also work closely with our vendors when there are issues that are identified so we can modify these tools, make sure they're working better and as well suited as possible to specific workflows.
That's a fantastic approach. And you highlighted the very important need for trust, both from patients and from clinicians. We also recognize that the needs of our clinicians are very different depending on the care setting and their specialty. So you're a critical care physician, I'm a pediatric hospitalist. We see very different patient populations. How are you engaging your clinicians and your patients to ensure that they're involved in the process and that you continue to gain their trust as these tools are being rolled out?
Yeah, I mean, I think the first is rigorously focused on evaluation. So, we have technology, we think we know what it's going to do. The way we're going to be confident about what the downstream consequences are in looking at outcomes, coming up with a deployment design that allows rigorous evaluation to be done to give us the assurance that it's working as intended. And so, part of that is things like scientific publication or internal evaluations that help give us that confidence. I think second is ensuring that we listen to the feedback of our clinicians, because they're working with these tools every day. They're seeing where they're working well and where they're not, and those are incredibly important pieces of feedback that are useful to continue to iterate and improve. I think the belief that, these tools are ready immediately out of the box and that they don't need further guidance or tailoring to specific workflows, I mean, that's a fallacy. And so I think we have to be deeply engaged in real-time feedback and this kind of two-way communications channel. And then finally, we've been doing research and surveys with our patients to understand what is their understanding of AI and what are the issues that we can work to mitigate when it comes to trustworthiness. So I think there's also a big education component for the public, understanding what is AI, what is not AI, what is the AI that's in use, how is it working, what's happening with my data. I think as physicians groups and as a health system, we could do a lot better here in terms of educating the public about ways that AI is used today and will be used to benefit their care.
Yeah, really important for all of us to recognize that we still have a lot to learn about all of these tools, and we're all part of the learning process, both educating the public and educating our clinicians, as you had pointed out. Sounds like you are incorporating feedback into all of these implementations. And as you think about growing the use of these tools, what are some of your visions for how to scale them across your very large system?
Yeah, it's a great question. I mean, I'll give you an example. So 2 years ago, Dr. Ansari, our CEO, took an incredibly bold step for the first large scale implementation of ambient AI scribes. And I think many of the listeners who may know about this technology, there's a secure, smartphone that records an encounter between a patient and a physician, it transcribes that, and then it used generative AI to draft a note, a medically consumable note, the summary, and then, ultimately the physician goes in and edits that note and then puts it in place for documentation. So I think what she saw was that there was the emergence of this technology. And the reason she felt compelled to lead our organization into a deployment that would allow for as many as 10,000 licenses, ultimately used more than 1 million times, and now today across our enterprise more than 6 million times, was really driven by the opportunities to reduce clerical documentation burden for our physicians and to improve doctor-patient communication. We've seen that bold step pay off in terms of both our physician and patient satisfaction. It's also meant that we've had to build a framework for how we evaluate that deployment. I would say one incredibly important piece of that was not only working closely with our vendors, we've now had 2 vendors to continue to build that system. So that's going to be a really important relationship. But also, our medical group has more than 1,000 physicians who have additional leadership roles in technology deployment. So they work across all of our 21 medical centers, across all specialties, and they're the local expert, for at the elbow support, for peer support, for communication, who work with their colleagues on new tools and also send feedback. So I would say sometimes there's organizations that are really proud of their technology stack, which is a whole bunch of cloud and servers and other systems. I like to think about our technology stack as including all of those physicians who are dedicating a small portion of their time to supporting their colleagues. I think that's going to be really important for us to scale, is ensuring that when there is a problem, when something's not working the way it should, or there's an integration point failure, or there's a customization that needs to be applied to a specific clinician's workflow, that we have those feedback channels, we have those support mechanisms, so we can continue to optimize for improvement.
That's such an important pearl. We talk about people process technology, and anybody that has done this recognizes the people and the process are so much more critical often than the technology itself in successful rollouts. So kudos to you for building that infrastructure with the people and the process to be able to scale large projects such as ambient rollouts. You'd mentioned that you as a team think about impact in various ways. Can you talk a little bit more about what constitutes as success in your organization?
I mean, I would say the first thing for ambient AI scribes is the feedback from our physicians and patients. And, many probably listening to this call have had the opportunity to work with this technology. Tears of frustration with technology are common in healthcare. Tears of joy with technology are far less common. And so, I think that's just an amazing outcome to see physicians whose lives have been transformed in some part because of the reduction of cognitive burden or because of time savings. And then in our surveys with patients, noting that the overwhelming majority felt that the patient was able to spend more face-to-face time interacting with them to enhance that level of communication. So I think we have to think about technologies as, ultimately them having a human impact on our clinicians and patients and being sure that we're tracking that. I think secondly, are we working towards our overall organization's goals of high quality, affordable, equitable care? And that's measured across many different dimensions. But are we finding that this is helping us to achieve that goal? And then even beyond that, and probably embedded within all of the things I've already mentioned, is this technology helping us to achieve the quintuple aim? That includes things like clinician sustainability. It includes better outcomes. It includes more equitable care. It includes reducing costs. So, I mean, there's any number of outcomes and benefits as well as, associated risks that we need to be measuring. I think it's tailored to each individual product and, each individual technology, but I think they broadly fit within those umbrellas.
And that is very similar to what we talk about at the AMA, which is the Return on Health framework, which looks at the quintuple aim as the 5 pillars of measurement of successful technology implementations and can translate, like you said, to all different tools in a slightly different way. knowing that each one is unique in its implementation. And I really appreciate the tears of joy comment. I used to say that it's when I get the hugs in the hallway that I know we did something right. Great pearls of wisdom. Really appreciate the structure you have developed. Do you have any other pearls of wisdom that you'd like to share with our listeners?
Yeah, I mean, I think AI is unlocking incredible opportunities to improve the way that we help patients and communities, as you said, achieve health. I think we need bold leadership at our organizations to really identify those killer use cases. And then we also need discipline to focus on those opportunities and make them successful. Right now, it feels like there's a million things swirling in front of our eyes. But again, we have to find those opportunities that help us achieve our goals, and then we have to be disciplined about how we implement them. We do need to train our workforce to understand both the advantages as well as the challenges of using AI so that they are equipped to maintain oversight and autonomy and maximize the benefit and minimize risks. And then finally, we need to make our patients and communities partners in this process. I think not far in the future, patients will be seeking health systems and doctors who are using AI because they would rather see that layer of support to ensure that, their physicians and health systems are equipped rather than fearing the technology. But we do need to communicate and educate to make sure that they understand exactly how it's being used.
Thank you. Fantastic pearls of wisdom. Dr. Vincent Liu, Chief Data Officer of the Permanente Medical Group, has been our guest today. Check out the episode description to explore the resources mentioned in today's episode. And until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.